you mentioned that rheumatologists get called in when they can't figure it out, but if someone's at home thinking, should I see a rheumatologist? The main question, I guess, is when should someone seek out a rheumatologist?
So there's multiple different reasons you would want to see a rheumatologist. Typically the primary, the first physician that the patient would see would be their primary care physician. And the primary care physician, when the patient's explaining their signs and symptoms, light bulb would usually go off. This is a little unusual. This isn't your run-of-the-mill wear and tear arthritis. And how do you know that? So we talked about inflammation a little bit. So the cardinal signs of inflammation going back 18 BC, rubor, calor, douleur, so a hot, swollen, red, painful joint is typically the joint manifestation. So not as much just pain, but actually swelling in the joint, warmth when you touch the joint, redness around the joint. Those are things that would prompt you to think this is more an inflammatory joint condition. And then again, because multiple organ systems are involved, other things, unexplainable fevers, which is commonly seen in lupus or some of the vasculitises, skin rashes, eye conditions, sores in the mouth, sores in the nose. So multiple different things. As far as the elderly population, headaches are, if they don't go away, they're atypical, meaning the patient has had headaches their whole life, but this is a headache they've never experienced before. They're having fevers, they're having weight loss. We would be concerned about a condition called giant cell arteritis, which is more common in elderly. So it affects patients 60 and older for the most part. And it's inflammation within the blood vessels that can eventually lead to blindness. And if it's treated early, we can avoid the blindness that is irreversible. So I would say, as far as the elderly population is concerned, a severe headache, any changes in the vision would prompt a visit to the emergency room, and the patient would then be triaged from there. It's not a general population condition that people are aware of, but any physician, when they hear about a headache in an elderly patient, that is the first thing that they would think about.